All right, good morning. I'm super excited for today. What we're going to be talking about today is our new clinical solutions product, and especially today is titled Retinol 101. So we're going to be talking about retinol, what it does to your skin, who should use it, who shouldn't use it, because there's a lot of ins and outs of this product because it's a pretty intense product. It's really, really effective, but it's also really great for some people. Some people should avoid it. There's just lots of information to cover. So that's what we're going to talk about today is retinol. And then I'm really excited. We're going to bring my mom on. She has tried the product. She's been through we call it the retinization process, which we'll talk about what that means. But she's been through all of that. So I'm really excited to hear from her so that she can tell you what to expect as you start this product. Okay, so I'm seeing some people on, so welcome everybody. I'm really excited to see you guys on. Okay, so like I said, I have a lot of information to cover. If you have questions or comments, let me know. I will do my best to get to those at the end. But first thing what we want to cover with our Retinol 101, what is it and what does it do? So retinol is a derivative of vitamin A and is considered to be a gold standard ingredient in skincare. That being said, it's very, very effective. It helps reverse the signs of aging, but you have to really, really know what you're using when you decide to use this product. This product, Clinical Solution Set, it comes with two different products. There's a retinol 0.5, and then there's also a facial milk. And we'll talk about what both of those do. But retinol, this is the ingredient that we are talking about today that's like absolutely incredible. This is obviously a topical application of retinol. So you're applying it to your face. And what it does is it helps improve the skin's structural integrity. It helps the natural production of collagen and elastin. Collagen is essentially a fibrous protein that is found in your skin, and it's like the skin's building block. And collagen, unfortunately, your skin stops producing collagen at a very young age. So this helps the natural production of collagen. It also helps the production of elastin, which is a stretchy protein, which helps your skin look nice and firm and bouncy and young. So we all want those things. We all want collagen, we want elastin, and retinol helps those. One other thing that retinol does is it helps your skin's cell turnover. So when your skin gets like old cells on top of it and it looks like it doesn't look super young and nice and pretty and bouncy. We want to get rid of all those like old skin cells, and we want cell turnover to happen a lot faster. Retinol does that. So that being said, like I mentioned, there are people who should use retinol and there are people who should not be using retinol. Somebody who should use retinol, which I think probably most of the world should, if you're over 20 years old and you want to reverse or prevent visible signs of aging, this is a great product for you. Okay, so that's honestly probably most people. But you should not use retinol if you are pregnant, if you could be pregnant, if you're nursing, lactating, if you're using acne products as well. It's essentially, I thought it was interesting as I was kind of researching retinol, it's essentially the same rules of using Accutane, because Accutane also has retinol in it. So avoid it if you're, once again, pregnant, could be pregnant, nursing, or if you're using acne products, then this is not a great product for you. Okay, so a few other things. The retinization process. So retinol, because it is such a great ingredient, but it's also very, very powerful, this is a pure retinol. We'll talk about the difference between this and between an encapsulated retinol. But this is such a potent product, you need to be very, very, I guess we'll say specific about very intentional about how you use it. So the retinization process is what we call the process that you go through when you are a first-time retinol user. After your skin is used to putting retinol on it, you do not need to go through this process after you've done it for the first time, okay? It's an 8-week process that essentially builds up your skin's tolerance to the first time of using pure retinol. Some of you may already be using the Time-Wise Repair line, which has retinol in it, but once again, it's a little bit different of a retinol, and we'll talk about how it's different. But this is a pure retinol. So everybody, if you have never used a pure retinol, you need to go through what is called the retinization process. What this is, once again, there's two products in this line. There's the Retinol 0.5 and the facial milk. the retinization process, essentially you're using this facial milk to help alleviate any discomfort, because it is normal, and we'll talk to my mom in a little bit about what she experienced, but it can be very normal to have flaking or discomfort or redness. And the facial milk, you can apply as much as you'd like, and it helps alleviate this discomfort, okay? I am going to show you guys something. Hopefully I can share my screen really quick. One second. Okay. Let's see, one second. I'm gonna share my screen. Okay. All right, so this is a retinization tracker. So if you decide that this is a product that you wanna try out, this helps track your retinization process. The first week, what you're going to do is you're going to use it. You'll see this up here on the right where it says weeks 1 + 2. You are going to use it 1 time per week on the same night, and you're going to dilute it with the facial milk. So once again, the product comes with a retinol 0.5 as well as the facial milk, and you're going to use it that same night and dilute it. So essentially you're going to put 1 pump of the retinol in your hand as well as facial milk to dilute it, and do it 1 time per week. So let's say you choose Monday. Here's your little tracker. You're just gonna put a little check right here, do it 1 time per week. On week 3 and 4, you're also gonna stay with 1 time per week on that same night. So stick with Monday, but then you're going to use just the retinol and then the facial milk. So you'll see how we're introducing our skin to the retinol, because once again, you can't just go with retinol right away. You have to introduce your skin to it. Week 5 and 6, you're gonna do it 2 times per week. So let's say we're gonna do like a Monday and a Thursday. Choose your days, don't do them on consecutive days, but you are going to do it just the retinol and then follow it with the Calm Restore facial milk. Then week 7 and 8, you can do 3 to 5 times per week. Once again, it kind of depends on what your skin needs. If your skin is needing a lot more retinol, if your skin can tolerate it, probably be more on the 5 times per week. If your skin isn't tolerating it quite as well, maybe it's a little bit more flaky, a little bit more red, you're still experiencing some discomfort, probably edge on more of the 3 times per week. So this is what the retinization process is. Once again, you need to introduce your face to this product because retinol is just such a potent ingredient that your skin cannot handle it right away. Okay, so let me get my ducks in a row real quick. Okay, so I'm seeing some comments. I'll get to those in just a minute, but a few other things that I want to go over before we get to comments or questions or any of that kind of stuff. How retinol 0.5, this specific product, the Clinical Solutions, is different from the retinol found in a lot of night creams. So if you're familiar with our skincare lines, Time-Wise Repair has retinol in it. It's in the night cream because you always apply retinol at night, never in the morning, because it can make your skin very sensitive to the sun. Also make sure that you are using an SPF during the day, but you always apply it at night. The difference is the retinol that is found in the night cream that we have, that you can put on your face right away. You do not need to go through a retinization process because it's encapsulated. It is not a pure retinol. So that night cream, if you're using it, it's super effective. It's a great product, but if you're wondering like, why didn't I have to go through some sort of process with that? That's why. It's because it's an encapsulated retinol rather than a pure retinol. How and when to apply it? This is a very good question and can be kind of confusing when you're introducing new things to your skin. You only need to use 1 pump, never use more than that. That is all you need. If you're, even after you go through the retinization process and your skin is really used to it, only use 1 pump. Don't think like, oh, well, if I use more, my skin is it's going to work a lot better and a lot faster. That is not the case. You only need 1 pump. You apply a little dot, so it's going to be a pea-sized amount, just 1 pump into your hand. Apply it on your forehead, your chin, and your cheeks, and then just distribute it all over your face, okay? Like upward and outward all over your face. As you put this into your skincare routine, this is where I think some people can get a little bit confused. Always start with your cleanser, then your eye cream, then you're going to put on your retinol, okay? So cleanser, eye cream, retinol, then any serums you might be using, then your night cream. Okay, so cleanser, eye cream, retinol, serum, night cream. A few things to note, because this, once again, is kind of an intense product. I would always recommend waiting 10 to 15 minutes after cleansing, because after you cleanse, it's going to start redistributing skin's natural oils, which can help alleviate any discomfort. Once again, do not use more than one pump. You do not need more than that. This product was designed only for one pump. Don't use more. You might have some temporary discomforts. That's normal, but you can use the facial milk as often as you'd like. There's a lot of women that use it throughout the day. Like, let's say you're experiencing some redness or discomfort at noon or whenever. The facial milk you can use whenever and wherever. And that is exactly what that product was designed to do. It was designed for you to be able to use all the time in order to alleviate discomfort. I'm going to share one thing real quick, and then we're going to get to my mom and her experience with it. But I'm going to share this. It has a few products that you should avoid. Okay, so this is our little product compatibility guide. There's a few products during retinization, so during that 8 weeks that you're getting used to, that you should not use. And then after retinization, it's a little bit different. But while you are going through this 8-week process, you should not use any of these products. The Refine for microdermabrasion, the facial peel, the invigorating scrub, and the exfoliating powder. Basically, any product that's like really intense into exfoliation should be avoided. Same with our Skin Vigorate Sonic system. Also avoid any high potent vitamin C. So that serum, you can use other serums like the tone correcting serum, the lifting serum, that's fine. Do not use any acne products or the eye patches. That's just during retinization. After you are retinized, you've gone through that 8-week process, then you can change it up a little bit. You can do microdermabrasion, the facial pill, all that, just like normal, just don't do it more than 2 to 3 times per week. Okay, so the rules kind of change a little bit after you've gone through the retinization process. And once again, it's because we're getting our skin used to, essentially just getting it used to having retinol on it. So that was a lot of information. I am going to get to the comments really quick. Let's see. Do you need to stay out of the sun? You don't need to stay out of the sun. Just make sure that you have an SPF on your skin. Bridget, yes, stop using acne products. Because they're just not compatible. It's essentially the same rules as Accutane. Don't use it if you're pregnant, nursing, lactating. Don't use it with other acne products like any of those. Any other questions on here? Perfect. Okay, so now we are going to get to somebody. I'm really excited to hear from my mom because she has tried this product. I haven't been able to try it quite yet. I've done a lot of research on it, but I haven't tried it quite yet because I am currently nursing, so I can't use it. But mom's been through it, so I'm excited to hear her experience and just ask her a few questions about what she experienced, what you can experience as you go through this process. So mom, I'd love to hear from you. How was your experience? What did you experience? Like, just give us the information on that.
Okay, I will. I'm excited about this product. When Kara first introduced me to the product, I got to tell you, I had to say I was a little bit hesitant because I use Time-Wise Repair. And I have been a faithful user of the Time-Wise Repair line and didn't think that I really needed anything much more than that. However, when I use my mirror next to my bathroom, and it's a 10 magnified mirror, I started seeing things over the last couple of years that I wasn't so happy about. But I mean, you guys, I'm 68 years old. And so I have to say, well, I am 68 years old. But somehow it was just making me sad that my skin was starting to just look a little bit more wrinkled and having the age spots come up because I was a sun worshiper. And but still, you know, I'm still pretty happy with the way my skin looked with using our incredible product. I have always been happy with it. So I use this product because I guess I wanted to be one of the first people to test it out. Well, the first night that I used it, it was really simple and I had no problem. And because I'd been using Time-Wise Repair, I already had a little retinol going on anyway. So my skin was used to it. The next morning, I was amazed. I saw a difference the next morning and I didn't expect that. My skin looked a little brighter. It was a little bit tighter. I'm like, okay, maybe I'm really going to be all in on this. Well, I only started using the product like twice a week, but because I've already been a user, I was able to amp that up to like every other day. And now I'm on pretty much every day using it. I will say that it is a very high-end product. This is keeping me away from going to, you know, these high-end places that sell treatment to my skin that are like $150 to $300 a session. And you have to come in every time and, do it like at least a couple of times a week. It's kind of keeping me away from that. But I will tell you that there is some adjustments. So to your customers, or if you're on this line as a guest right now, I want to tell you that what to expect. Well, what I expected is I got a little tiny bit of burning, but the facial melt helped a lot. I mean, it's got coconut oil in it. It has like 4 or 5 natural oils in it that really soothe my skin. And the other thing that I noticed too is because I had really been using the repair line clear down on my throat and my décolleté area, that I started to do that. But because my throat and my décolleté wasn't used to using retinol, I had a little bit of retting and it was kind of sore. So then I okay, I got to treat my face different than my throat. I had to be a little easier on it. So what I noticed on my skin after a couple of weeks, and that's like up until like last week, is I started having a little bit of the dead skin cells come up and marbling. And I really needed to get those dead skin cells off. I mean, they were between my eyes, around my eyes, and I could almost feel them peeling off. And that was a good thing because I knew they were deep down in my dermis. And, dead skin cells are never pretty. They're kind of grayish. They're ashy looking. They just don't make your skin look bright or taunt. So what I did is I decided that I would use the brush. And that helped. I used it very lightly. That helped get those dead skin cells off because I felt like they were like glued to my skin. They were kind of marbly looking underneath my skin. So exfoliating that was really helpful so I could see that brighter skin coming through. But I have seen that this is more than an anti-aging product. It is like taking the clock and backing it up. So I looked at some pictures of myself now, and I looked at some pictures of myself like 10 years ago. And before I started using the product, I could tell there was a 10-year difference. But now I'm starting to see my skin look as young as it did 10 years ago. So I'm really, really thrilled with the product. So at $120 a set, I want to tell you, I am a customer and I'm going to be using this product. It takes so little and lasts so long that I've been using it for about 8 weeks now. And really, I barely see a little dent at the top of the product. It's very long lasting. I would imagine it's probably 3 months, but it's definitely worth it. If you do the math on this, oh my goodness, this is a great product to use. Now I know because I'm your customer who is definitely over 50. I would definitely suggest that you market to people like myself. But here's the other thing I was thinking about. If I wanted to have a business out of my home and I wanted to be able to represent a product that was fantastic, I would probably start with this one as a brand new consultant because people need and want a product like this. And what I also noticed, and I think Kara could agree with me and everybody who is a consultant on the line tonight, is there is nothing like this on the market. There is nothing that a customer could purchase like this. It's patented. Of course, and it is pharmaceutical grade, and it's like what doctors are using in their offices, except for the difference is you don't get a milk to soothe the skin so much. And I really recommend the product. And coming from a hesitant position, just because I'm naturally skeptical, I will tell you I give this an A+. Absolutely, gotta have at $120, gotta have it. And enjoy, look your best, feel your best, and use it right along with your other products like what Kara suggested. Avoid those ones that she suggested. Now, just by the way, because I had so much dead skin cells coming off of my face, I did start using the microdermabrasion yesterday, and it really helped get a lot of those dead skin cells off. So my skin looked better. Oh, and one other thing I noticed too, I use a lot less foundation because I have less to cover. My brown spots, all of them are gone except one small one right here. And that was actually the size of a quarter. Now it's really small. I noticed my pore size is smaller around my nose area. I also noticed that my throat is actually getting smoother as I'm starting to introduce my throat décolleté area about twice a week instead of every day.
Mhm.
because I wasn't using it on that area before. The other thing that I noticed is my skin is just much brighter and a little taunter, especially around my chin line where I'm starting to have jowls. It just is like, it's like a little mini facelift for me. So definitely A plus, you guys. Enjoy having your customers use this and really seeing major, major results within a few weeks. So Mary
Awesome.
Kay, home run Mary Kay for sure.
Thanks for sharing, Mom. So a
Yeah.
few things I want to comment on really quick, and then I know I saw some comments that those who are watching have. So a few things I want to say is next week we're going to do our dermaplaning event, which is going to be really great. And then the week after, we're going to show some retinol before and after pictures, which will be really cool. So you can actually see like, this was their before picture, this was their after picture, and like see the difference that it makes. So you can really be motivated to try it. Another thing like that Mom said is this is a really great product to represent. If you are interested at all in becoming a consultant, I'm here to answer questions. I know there's a lot of other consultants in here that are willing to answer questions, but one of the greatest things about being a consultant is you get your product at half off, which is awesome. So then you're like, this product is great to represent and to sell, but it's also great to use on yourself and get a discount on. So let us know if you have any questions about that. I'm going to get to a few questions to ask you, Mom, that were asked. Bridget asked here, at what week did you start to see the dead skin cells?
Okay, I started to see that like week number 2, but it wasn't a lot. It just increased. And I realized, oh my gosh, I have really had an accumulation of dead skin cells on my skin. And I think, I hate to tell you this, but I wasn't using microdermabrasion like twice a week like recommended. I was using like once every other week. Well, after the years and years of putting product on my skin and foundation and all the stuff that just gets in that pore and digs so deep into our dermis, I realized I had some major stuff that needed to come out of my skin, and I saw it. So I just saw dead skin cells accumulating every week. They were starting to slough off. But this last week, the 8th week, oh, I really saw it. It's like, oh my gosh, I just got a bumper crop of dead skin. And because my skin's now used to using this product, I could use the microdermabrasion, and it sloughed all of it off.
Right.
Biggest thing this morning when I put just a tiny bit of foundation on, as you can tell, I don't have a lot of makeup on. I just put a little foundation, and you guys, it is so smooth that it just like glided like cream on my skin this morning.
Good. Yeah. I'm glad to hear that. I'm glad, Mom, that you said, because it's not recommended to use microdermabrasion during the retinization process, but after your skin's used to it, then you can. That's the same with any like deep exfoliant. So thanks for mentioning that. And that's interesting too, that you had most of your dead skin cells at 8 weeks, like after the retinization process kind of occurred. So that's interesting. Okay, another question. Aquila says, good morning, your skin looks beautiful. Now, when you used your brush, did you use it after your cleanser?
During my cleanser. I put on a cleanser, rinsing it just a little bit, so it kind of gave that brush a little bit to work with. And I used it with the cleanser very lightly, and it was getting a lot of that surface dead skin cell, that marbleization. You guys, I even had some like plotches of kind of an oily, mucky feel. I know that's gross, but that's what was in my skin after years of, things just, plowing in there. Yeah. Right. Yeah. But it looks a lot better.
It does, right? Well, cool. Yeah, because it's, like we said, this is a really, really great product, and it can help your skin look a lot better, like Mom said. But just make sure that you are very aware of what you need to do. Like use the retinization tracker. And I will say, when you purchase the product, it has this information in there. So that tracker that I shared with you, it's right here. So, because if you're like me, I would probably forget. I'm like, wait, week 1, what do I need to do? Do I need to dilute it? Do it once a week, twice a week, whatever. It's all on here. And there's tons of information on here when you purchase it. So I will say that, but just make sure, like I said, that you are very aware of what you're using and that you're very diligent with it. Because if you don't use it the right way, it can cause a decent amount of irritation. But there's also that facial milk. And you said that facial milk was really helpful for you, right, Mom?
Oh my gosh, yes. And you can use it right over your makeup. So
yeah, during the day and everything.
It's a great little product. The other thing is that what really encouraged me is I started getting pictures from other national sales directors that showed their before and afters, and it really encouraged me to keep going with it. Not that I would become discouraged. You know, we get kind of set in habits. We go to bed, we use the same product, whatever. But this was really good. So as you're showing the product, feel free to use and show these before and after pictures. I think my before and after is dramatic, but I've seen some that are super dramatic. Yeah.
And it's really cool too, because we'll show you the before and after pictures in a few weeks. But what's really cool about them is I've seen a lot of them from like really young people, like in their 20s. Once again, it's not recommended before 20, but after 20 it is. And it's really cool just to see how much it brightens your skin. And of course, if you're really young, it's not like you have deep wrinkles or like age spots or things like that, which it will help if those are what you have. But even if you're really young, it just helps brighten your skin, make look a lot younger. And so it's a really great product.
Yeah. Well, you know, Kara, I was also reading about this too, about how your skin stops producing vitamin A, which keeps your skin young and elastic. By 1% after the age of 20, it decreases by 1% every year. So I'm kind of doing the math on that. Like, well, I'm done. Yeah, so I really, really need this product.
It's so true. So yeah, it's definitely great in just helping your skin do what it should be doing for longer, because we don't want it to decrease that like collagen and elastin. We want it to increase that for a long time. So it's a really, really great product. If you guys have any questions about it, any questions about getting the product, becoming a consultant, sharing, like selling the product, like whatever you have questions about, please put it in here and we will answer what we can. Yeah. Awesome. Thanks for joining, and thanks for joining us too, Mom. It was great to hear your experience.
Oh my gosh, you're so welcome. I'm so proud of our company. I'm so proud that they've spent so much time and effort in putting together a product that is not only fabulous, but so well tested from our brand new manufacturing plant in Dallas, Texas, that the company not only is completely debt free, but they've come out with products regularly that are so far in technology that really nobody could even touch. Nobody could even touch this, and at a price that really is affordable. You guys go price checking some other things, and I think that you'll be amazed at how well priced our product is for the quality that you get. Is just untouchable. I'm very proud to have been associated with Mary Kay for all those years, and you guys, best of luck with everything. You're an incredible company that cares and does, over delivers on everything.
Definitely. Thank you so much, Mom. We appreciate it. Everyone have a wonderful Saturday, and we will see you guys next week for our dermaplaning event.
Thank you.
Bye.
Bye-bye.